And if it's okay, you can go ahead and click continue. If not, recommend just blacking out your screen if you want to continue to participate. All right, so I want to thank everyone for being here on our Red Zone Prevention Friday Sexual Wellness. I'm really excited about today's topic and about everyone who's here to help with the discussion. I'm Lauren Johnson. I'm the Prevention Coordinator at the Wellness Center. My pronouns are she, her, hers. And if you are new to Red Zone is the first 8 weeks on any college campus when students are at greatest likelihood of experiencing assault, injury, or overdose. So what Purchase College has done over the past 3 years is to create this awareness campaign that we call the Red Zone Prevention Series. And it's really encouraging and really great how much the community has wanted to come together and provide awareness and education in order to reduce individuals' risks and their peers' risks. So we always love this time of year, and it's a little bit different this year as we're doing it virtually, but it's a great way for us to be able to get some awesome speakers like Zoya we have here today to come and join us virtually. So for today, we really are focused on providing some information today on how you can maintain your sexual wellness, how you can reduce your risks that are associated with Red Zone. So things like sexual wellness, assault, injury, substance-related sexual assault, and we just want to provide as much information as possible so that you can make decisions that are appropriate for you. We're really hoping that from today's session, whether you're here with us right now or watching this at a later time, that you're able to kind of get this conversation started with your peers and spread some information about what you learned here today and about the resources that we have available at Purchase College and in our community. So we are going to start off with Zoya Diaz from St. John's. She's with the HOPE Center, and she is a preventionist over there who's got some really great information to share with us today. So welcome, Zoya.
Thanks. Everybody hear me okay? Okay, awesome. Hi, everyone. So my name is Zoya. My pronouns are she, her, hers. We are going to go into like a prevention boot camp right now. So please join me. I'm just gonna share my screen and we'll get going. Okay. All right, so just go into, hello. Oh, okay. Okay, so I am the prevention supervisor here at the HOPE Center, which is part of St. John's Riverside Hospital in Yonkers, New York. Our goal in the prevention program is to prevent new cases of HIV and hepatitis C, and also prevent transmission for people who are already living with HIV or hepatitis C. We also provide linkages to care for all types of services, whether it be primary care, hepatitis C cure or treatment. We have a Hep C team and program on site, and I can talk at length about all our wonderful services. Today we're going to focus on the prevention program. And that is our new logo. Look at that. So in 2014, this is kind of a background of where our work is based around. So in 2014, Cuomo detailed a 3-point plan known as the Ending the Epidemic Blueprint. To really, the end goal was to move us closer to the end of the HIV and AIDS epidemic in New York State. So there's a 3-prong approach to the Ending the Epidemic, or ETE. So that really means to identify people with HIV who aren't diagnosed yet and link them to healthcare. Link and retain people, so keep people in care who are already living with HIV to maximize what's called viral suppression. We'll talk a little bit about that. So they can remain healthy and prevent further transmission, and also to facilitate access to PrEP. So to make PrEP access easier, which is something that I will talk about as well today. And we will also talk about what PrEP is. So yeah, that's a little bit of the Ending the Epidemic Blueprint. I just want to give a little bit of a shout out to trauma-informed care. So this is a safe virtual space. The HOPE Center's focus on trauma-informed care and recognizing and responding to stresses that may affect individuals. So if any of the material we cover today feels troubling, overwhelming, anything, I really just You know, I implore anyone who needs it to take a step away from the computer. You're welcome to come back, do whatever you need to do to take care of yourself, and also reach out to one of the facilitators if you need you know, an additional level of support. All right, so we're going to go into some definitions. So usually this is where I kind of open it up to the crowd, because what is sex? So sex is very different for different people. What one person might consider sex, another person might not consider sex. There's all different kinds of sex. So maybe someone might consider playing with sex toys sex, whereas someone else might not consider that intercourse. Or so yeah, I like to keep the definition of sex very fluid, because it truly is different for all of us. HIV stands for human immunodeficiency virus, and AIDS stands for acquired immunodeficiency syndrome, and we will talk a tiny bit about the difference between HIV and AIDS. STDs and STIs, oftentimes people use them interchangeably. We're trying to move toward a place of using STI. So an STD is a sexually transmitted disease, and an STI is a sexually transmitted infection. So it might be a germ or an infection that could turn into a disease, but not necessarily. And HCV, that is hepatitis C. It's kind of a funny acronym. So hepatitis C is abbreviated as HCV. So we talked a little bit about this. It is a virus that attacks people's immune system, and if left untreated, the virus may lead to a diagnosis of AIDS. And so AIDS is when a person's immune system is so compromised it can no longer protect the body as it should. So people themselves who have HIV and it progresses to AIDS do not actually die from AIDS or HIV. And actually, in this day and age, it's very rare. We used to think of HIV and AIDS as what some people call a death sentence, and we're moving away from that language, because people who have HIV and even AIDS nowadays, if they stay retained in care and on their antiretroviral medications, have the same life expectancy as other individuals. And that's often a misconception. STI, we went through that a little bit, so I'm gonna respectfully skip this slide. But STIs are mainly passed through sexual contact, so we'll get into that a little bit as well. And like stated before, this is when an STD is when an infection has caused a disease. So a few common STIs we can talk about. There's gonorrhea, chlamydia, syphilis, herpes, and HPV. These are very common STIs in our country. The most common one is actually not on there, but I'll hit it in a different slide, but that's called trichomoniasis. So a little bit back to HIV, the virus weakens the immune system and it makes it hard for it to do its job, which is to protect the body. An important kind of immune protector, it's called the T cell. So T cells are in our blood and they also go to other places in our body. There are three types of T cells. They're killer, helper, and regulatory T cells, and they all have their own awesome job to do. Helper T cells call in more killer T cells to kill germs, and those tell the regulatory T cells when to make antibodies. So the testing that we do in my program is 20 minutes. It's a rapid, what we call a rapid test, and it's actually just a finger stick. It's really the most updated and accurate test that's out there for rapid testing, more accurate than the oral swab. And it also has a shorter window period than the oral swab, which means that it will detect HIV or hepatitis C much more quickly than the previous oral swabs. And so with HIV, there are different ways to get different STIs, and with HIV, it necessitates an exchange of body fluids. So HIV is possible to contract or to get through pregnancy or childbirth, breastfeeding, unprotected vaginal or anal sex, as well as oral sex, and sharing needles. And there are different what we call risks or transmission risks for each different type of sex. So anal sex is the most risky form of sex for HIV risk. And that is really because of anatomy. It comes down to anatomy. It has nothing to do with someone's lifestyle, anything. It comes down to anatomy, and the facts are is that the rectum is very, very fragile and delicate. So if there's more tearing, there might be more blood present. And microscopically, we can't always see the blood that's present during sex and not necessarily feel it, right? So that's what makes anal sex the most risky form of sex for HIV contraction. So this slide is just a little bit of a breakdown. I like it visually. I find it helpful. It's a nice CDC poster. These are just some of the youth statistics regarding STIs. I believe this data is, oops, sorry guys. I believe this data is from 2018. And I'm just gonna ask us to take a brief look. I'm not gonna go over it in detail, but you can see some of the prevalence. So right now, young people do account for a substantial portion of STIs, new STIs, with gonorrhea at 70%, chlamydia at 63%, and these are also broken down by ages 15 through 24 and ages 25 plus. This is a great example of, I think sometimes, you know, we think about ourselves and we think, oh, I'm not so at risk for this, that, or the other. But then sometimes when we open up these conversations, we may realize, oh, I didn't even think of that as being a risk. Yeah, and that's why I like to talk about stuff. Okay, so chlamydia, I'll start with very briefly. Chlamydia is a bacterial STI. So that does mean that chlamydia can be cured with an antibiotic. Over time, chlamydia can cause permanent damage to reproductive organs. Most cases are asymptomatic, as are most cases of STIs, which is fun, right? Because you really don't know what you have until you get tested, or what you don't have until you get tested. So for people with vaginas, abnormal vaginal discharge might happen, a burning sensation or sensations while urinating. For people with penises, discharge, burning while urinating, or pain and swelling in one or both testicles is possible. And there is something, so rectal chlamydia might include pain, swelling, or bleeding of the rectum. And with chlamydia, we'll go next to gonorrhea. We need to talk about something called 3-site testing. So a lot of people, I think you just need to know that when you're tested for chlamydia or gonorrhea, it's usually a urine test, and it's actually great to have a provider who you're comfortable speaking with about the types of sex that you have, because chlamydia and gonorrhea can actually live in your throat and in your rectum. So it's very important if you are engaging in oral sex or anal sex without a condom. It's very important to get those sites swabbed, and most places won't actually offer that up front. It's something to request. But so chlamydia and gonorrhea won't actually show up in a urine test if you have it in your throat or if you have it in your rectum. So it's really important to request those types of tests. Gonorrhea is also a bacterial STI. That does mean it can be cured by antibiotics. We'll talk about that very briefly at the end though. It can cause infections in the genitals, rectum, and throat. So for people with vaginas, it can lead to pelvic inflammatory disease, infertility, what's called an ectopic pregnancy. So that actually means when the fetus is developing outside of the tissues that it's evolved to develop in. So that's a very high risk pregnancy. So most cases of gonorrhea are asymptomatic. There might be pain, burning during urination, increased vaginal discharge, spotting, soreness. And for people with penises, sometimes there might be burning as well, discharge, painful or swollen testicles. And something like with chlamydia, it actually is possible to transmit chlamydia during childbirth, and if the fetus is passing through the birth canal, chlamydia can actually be transferred from the birth canal to the fetus via conjunctivitis, so via an eye infection, and in a few different ways actually. So that's something, you know, I learned doing my work, and I didn't know. A lot of people don't share this information when you go to the doctor, right? So syphilis, another bacterial STI, it can be cured. There's a series of shots to cure syphilis. It's contracted by direct contact with what's called a syphilitic sore or syphilis sore during vaginal, oral, or anal intercourse. That sore can be in or around the mouth, around the penis, vagina, rectum, and the lips. And it can actually also hide. You know, how often are we actually like looking with a fine tooth comb, and we might mistake something for a razor burn if you shave, or it could, and a syphilitic sore is not painful, so it's actually pretty easy to not notice, and it goes away usually within 2 weeks. There are different stages of syphilis, but it can actually lead to blindness, dementia, even death. Al Capone famously had syphilis, and by the time he was, I think, near his death, it was said that he had the cognitive ability of a young child. And what I will say about the bacterial STIs is it's really important to protect yourself, even though they are curable, because over time, as if these infections, like one keeps getting them, the antibiotics won't be able to do their job as well. So it is possible to not be successfully cured. Okay, so some other known STIs, HPV, so human papillomavirus. It is a virus. Right now, we don't have viruses that can be cured except for one, which is hepatitis C, and that's extremely exciting that we can now cure hepatitis C. So HPV, it's a virus. There's no cure. There are roughly around more than 40 types of HPV. So there are treatments for associated health problems. Most people never develop symptoms. It's a really, you know, it's important to get tested, and also something like HPV, genital warts, syphilis, or herpes can actually be passed through skin-to-skin contact depending on the circumstances. So there might not be a perceived risk, right, of maybe hooking up, and there might not be a perceived risk when really some of this does just actually require rubbing, right, like skin-to-skin contact. So genital warts, they're a particular strain of the HPV virus. The signs are the same for all people, just they're found on different genitals. Pink, red swellings that merge into a cauliflower shape. They may itch, or there may be no pain. So it's really important, if anything is happening to your body that you're, you know, unfamiliar with, not to just ignore it, because it might, you know, even if it's like a rash that doesn't itch or doesn't hurt and goes away, it's easy to forget about, right? Especially when like finals are happening or all that good stuff. There is an HPV vaccine. It does not protect against all strains of HPV, but it does protect some of the hardest hitters. So some of the strains that can lead to things like cancer of the vulva, cancer of the anus and throat, and vagina. So those are some of the long-term risks from HPV. So genital herpes, it's a very stigmatized virus, and why I say that is because you know, no one wants herpes, right? But herpes does not actually damage or harm someone, and you know, the outbreaks are because of stigma. Unfortunately, the outbreaks can feel embarrassing to individuals. Maybe you might feel run down if you have a herpes outbreak, but it's not actually damaging or harming your health. So I like to use herpes as an example of how powerful stigma can be, because it's not, Of course, it's an STI, but it's also a highly stigmatized STI, and I think it's worth saying that. And so most cases of herpes are asymptomatic, and it's very commonly a misdiagnosed STI. It is a virus, so there's no cure, but it can be managed with medication. And so trichomoniasis, it's parasitic. And the reason I kind of differentiate between bacterial, viral, and parasitic are because treatment and cure might be different, right? So trichomoniasis, or some people call it trich, it's a parasite. It is curable with an anti-parasitic medication, generally a cream for trich. It is the most common STI in the United States, with roughly close to 4 million people having trich. And trich is a little bit similar to crabs in the sense that parasites are small bugs. So it's a parasitic cream usually that cures it. All right, we're gonna shift a little bit to hepatitis C. So this is a table here about A, B, and C. There are a lot of hepatitis C, hepatitis viruses. I think it goes up to G, like there's hep A, B, C, D, E, F, G, and each one has different genotypes. So hepatitis A and B, there are vaccines for. Commonly we get them when we're young. So there are vaccines for hep A and hep B. There's no cure. But for hep C, there's no vaccine, but there is a cure. The cure used to be treated with something called interferon, which some people really describe interferon as just as bad, if not worse, as hep C. And we have now much, much better medication with, a lot of people say, few to no side effects at all, and can actually be cured in as little as 8 weeks, which is pretty incredible. So hepatitis C is generally, it's spread through blood. So it is caused by the hepatitis C virus. And what hepatitis means, the actual meaning of the word is swelling of the liver. So so that can happen without a virus, but hepatitis C is a virus that can lead to that swelling. And so it's spread through sharing needles or works when injecting drugs. It can be spread from an infected, someone who's pregnant to a child during vaginal birth. It is possible to get hepatitis C through sex, but it is a little less common. It's the most life-threatening of the hepatitis viruses, but it can be cured. When we talk about works, so works is a term that might mean anything that you may use to get high, or anything that's part of that. So like, you know, a lot of people say paraphernalia, right? But works is anything. If someone shoots, their cotton is considered works. The needle is considered works, but all the parts that someone might get high with. Hepatitis C can also be spread through snorting things. So if you are snorting something with a bill, whatever it may be, a piece of paper, and you go to pass it to your buddy after, there might be a little bit of microscopic blood that, of course, you might not be able to see. And when your buddy takes it, also does their thing, then they are infected if, you know, the blood has shared with their blood. And because the inside of our noses are so delicate, they're fairly easy to bleed. And that's also something that I think is overlooked with hep C. What I like to say is be selfish with your works. If you're someone who does drugs, be selfish with your works, but be giving with your stash if you know, you're getting down. So transmission, how can a person contract HIV or another STI? We did talk a little bit about this. So some, like HIV, require the exchange of bodily fluids. Others, like HPV, herpes, can be transmitted through skin-to-skin contact. So prevention. So how can we prevent HIV, hep C, or other STIs? Some methods described here: using a barrier, such as condoms, classic or insertive condoms. They're sometimes called female condoms, the insertive ones, but I like to use the word insertive. They can be used by anyone. You don't have to identify with one gender to use an insertive condom. They can be used in the vagina or in the anus and do a really wonderful job of protecting you from HIV. It's also a great method, the insertive condom, for someone who might be having sex for like transactional sex is what we call it, and maybe sex for money, maybe sex for drugs or housing or a safe place to sleep for the night. That actually, it's a great method for people who are engaging in transactional sex, because they might have less of an ability to protect themselves. So an example might be if someone says they'll give that person more money if they have sex with them raw. This actually is an option that you can still protect yourself while that person doesn't feel the sensation of a classic condom or something like that. So I love insertive condoms. Having both partners tested before engaging in sexual activities. Sometimes this is realistic, other times it's not. It really depends on the person. So does limiting the number of partners, or practicing abstinence is also an alternative, but it's not realistic for some people, and that's fine. So harm reduction methods for safer sex and/or substance use. So harm reduction really means it's not coming from a standpoint of abstinence, but it's really coming from a standpoint of, okay, if I'm not ready to totally let go of some of these things that are putting me at an increased risk for A, B, or C, what can I do to decrease the risk while I still engage in those behaviors? So that might be, you know, if there is substance use, it might mean something as simple as cutting down or tapering use. So maybe not using the same amount every time. It might mean getting high with a buddy system, so you're not alone and at risk if you're shooting up, and there might be a risk of overdose. Or so that's a really good system, an example of harm reduction. Negotiating safety and using condoms with non-primary partners when possible. So of course that's not always possible, and it is difficult for a lot of us to have conversations about sex. And so PrEP is also an option, and what PrEP stands for is pre-exposure prophylaxis. You can kind of think about it as birth control for HIV protection. So PrEP will protect you when you're someone who's negative for living with HIV, so not living with HIV, and can actually protect you up to about 99%, even with condomless sex. It's a wonderful, wonderful drug. There are two types now. There's something called Truvada, and there's something called Descovy. I have a lot more detailed information about both of those, and can also talk in the chats a little bit more. And if it's okay, I'm going to read a tiny bit. Our PrEP coordinator, Bernard Galleno, has given me a little bit of information. I hope it's okay to share about PrEP. He wanted me to share about something called the PrEP app, which is a New York State program that one can apply for coverage of medical visits for PrEP. And it covers about 20 medical services. PrEP can be covered through private insurance or through Gilead, a co-payment program. So Gilead is actually the pharmaceutical company that makes PrEP. And there's also something called the Gilead Advancing Access Program. And if anyone is interested in PrEP, I would love to give Bernard's information at the end of the presentation. And also share that there are ways, even if you're still under parents or family members insurance, there are actually ways to protect your autonomy if you would like something like PrEP or HIV services, but you don't want your parents or family members to know. And I think that's a really important resource, because that can sometimes be a barrier to our safety, right? So we talked a little bit about abstinence. All right. So, do you know your status? So like I said, the HOPE Center's prevention program, we do offer free HIV and hepatitis C testing. When you get tested, we also have some newly designed like promotional giveaways. So it's really awesome that there are different things you can pick from with a test. And I always, always, always give out wonderful condom packs whenever I see people. And there are different incentives if you're coming for like longer, maybe a longer stay with our program. And what I mean by that is if you're being linked into care and we're following you more, there are different incentives that might include monetary incentives. So you can know your results in as little as 20 minutes with rapid testing for HIV and Hep C. And I gave my information in the chat box. I did give some here as well. That is my number listed. And please, please, I'm always open to sharing information. This is my life and I love to talk about it. So if any of you have any questions that you maybe don't feel comfortable asking right now or in the box, please feel free to reach out to me. And I'm gonna end there if that's okay.
Thank you so much, Zoya. So much amazing information. Thank you so much.
Yeah, thank you.
Before we move on, could you quickly just discuss what STI testing looks like in the time of COVID?
Yes, thank you for bringing that up. Yeah, so for my program, we do have mobile testing, and we test in the community, so we can actually come to you. There is testing in our clinic on site in Yonkers, but with our program, we can actually come to you. So right now we have implemented safety screening. So before actually seeing us physically, we'll have a few questions for you, some screening questions. Once you sort of pass that safety screening and we are meeting in person, we have fitted the van in a different way. We actually removed one of the seats from the testing unit so that now it accommodates space for someone with about 7 or 8 feet between. So what that'll actually, and we'll also temperature test. We have PPE on, of course, face shield, mask, gloves. We also have, if a client who are testing wants one of those items and maybe forgot it or doesn't have a mask, we also have masks for clients, hand sanitizer. And so we do kind of go through different levels of screening as you get closer to the test. And really, we're going to just be within 6 feet of you for the finger prick, and that's it. So all like intake paperwork and the 20-minute window of waiting for the test will actually be socially distant. There's also different, there's good ventilation, you know, we're not keeping windows closed, we're not doing AC, and it's still in a totally confidential setting, yeah.
Awesome. Thank you.
Yeah.
And I think you brought up a lot of good safety measures that that your center is using when it comes to COVID. But for our students who are not on campus or are not in Westchester right now, these are good questions that you can ask testing centers in your local area if they're taking these safety measures when it comes to COVID. So make sure and ask these questions because it sounds like that STI testing could be done in a very safe way, even during COVID, and it should not be a deterrent when it comes to getting tested.
Yeah.
All right. So before we start questions for Zoya, because I know I have several, I wanted to introduce Catherine from our counseling center. She's our campus advocate, and I wanted to give her the stage for a bit to talk about what she does.
Hi, everyone. Can you hear me? Good. Okay. I'm Catherine Vanbomel. I'm one of the counselors in the counseling center, as well as being the victim advocate on campus. And we just wanted to be sure that the students were aware of our campus advocacy program, which is a program through the counseling center that is, the objective is to help students in the immediate aftermath of a sexual assault. It can be a very complicated and frightening time for students. And so we want to be able to sit with them and kind of walk them through what the resources would be, get them the medical help they would need, kind of help them to understand their choices and what they'd like to do. Everything is up to the student. We would not make any decision for you at all. So please tell your friends about that as well. You can find additional information about campus advocacy services on the Counseling Center website. There's a little brochure that we usually give out to students. You could just click the link and it will come up.
That's awesome. And for our students who are not on campus, do you have any resources for them if they're experiencing any of these things?
Yes, so for the students that are not on campus, they can still use the service, and what we would do would be to look up a local victim service agency in their location, or most trauma hospitals have a way to do forensic exams.
Amazing. Thank you.
Thank you.
And EJ, I wanted to provide a stage for you too, if you wanted to talk about what your student organization does.
Sure, yeah. So I am the co-president of the Alt Center. We're currently providing virtual and on-campus services this semester. And our on-campus services are mostly going to revolve around giving students free resources, such as free products that are for safe sex, even though it's not the most useful thing this specific semester. Also general hygiene products and menstrual products. We're looking into getting gender affirming products as well, but that doesn't look like that's going to be something we'll have the money to get this semester. But yeah, so that's mostly our on-campus services. We're located in the basement of Terra Bay in room 0007, and we'll also have signs up on our door there. And our virtual services are going to be virtual programs, and we'll have more info about that on our social media websites. And you can find our social medias on our Panther link, which if you just go to Panther link through the purchase website and look up the Alt Center, everything about our club, well, organization, not club, will be listed on our page. Yeah.
That's great. Thank you so much for joining us.
Yeah.
All right, so now I want to open it up to questions for Catherine, for Zoya, for the general group, as we're talking about sexual wellness. I also want to point out that Matt put the Counseling Center's link there, and if anyone needs it.
Thank you, Matt. Yeah.
Great.
Awesome resource. All right. Anybody have any questions at this time?
I have a question, but it's about assault and STIs. My friend was recently raped and penetratedly, and she went to go get tested, I think immediately after, like maybe a day or two after, but then she asked her doctor what the results were, and they said they couldn't give it to her for 30 days, and she didn't know like what to do at that point. And I mentioned PrEP, but she said that you need to take PrEP immediately. I was just wondering what you could do if you've been assaulted, it's been a few days, and you don't know if you've contracted the virus.
Thank you. That's a wonderful question, and it reminds me to speak about PEP. So the side on PrEP, like we talked about, is the pre-exposure, right? So before you've come in contact with HIV, if there, and thank you for sharing as well. If an assault has occurred, if a condom broke or there was no condom, people are eligible to take PEP, what's called post-exposure prophylaxis, or PEP. It's kind of like, you can think of it as the plan B of HIV, essentially. And so PEP can be taken up to 72 hours after potential exposure. It does sound like your friend might be outside of the PEP window. And I would hope that the provider who they saw was able to share that resource with them. PEP is something that is ideally taken as soon as possible after that potential exposure, ideally within the first 36 hours. And PEP is a 28-day course of meds. And even if someone has been exposed to HIV, PEP will knock out that, that bit of the virus before it has a chance to spread. It's an incredibly, incredibly important and amazing drug. And thank you for bringing that up. Yeah.
Thank you. Now, I mean, I know that for her, maybe, you know, it's not possible to take that, but in the future, I'll definitely keep that in mind and mention it to whoever shows
Yeah.
me that they've been
Yeah.
assaulted. Thank you.
Thank you for sharing. Thanks.
Catherine, did you want to add anything for that?
It just made me think about if your friends or anyone in that position gets a forensic exam, that would be just part of the follow-up, and they would actually also have that as evidence collection, part of the evidence collection.
Yeah, that's a good point too.
And
I don't think she did a forensic exam, but that is something that's useful if she ever, yeah.
right, and there is in New York State, there is an agency called Victim Services, Office of Victim Services, OVS, and so you can apply for state compensation to get funding after a sexual assault through that
Wow.
office.
So,
Yeah.
Medicine can be expensive.
Yeah, I feel like for so many people, I mean, I don't know why she didn't, you know, get the forensic test, but personally, like, it wouldn't be my first thought just because I'd be afraid if I mentioned that I was raped or assaulted that nothing would really come out of it. And that's like, I think maybe what keeps people from doing it.
yeah.
Well, also it is a medical follow-up.
Yeah,
Sounds like it's only a, you know, a police kind of follow-up, but it's
Yeah.
actually a necessary medical follow-up.
yeah, that's good. And it sounds useful.
Mhm.
Yeah.
And Lau, I think you highlight a really important problem that not all medical providers are experts when it comes to sexual assault, and they're not maybe knowledgeable about the resources that they have. And so programs like this and Zoya's presentation and Catherine's presentation here, that's why it's so important to know our resources. So if we find ourselves or somebody we know in this circumstance, we know our resources. For our Purchase College students, Catherine is an invaluable resource for us to be able to connect us with different things that we have in the community. And depending on the survivor, what they're comfortable with, what they're looking for, Catherine has a variety of different things that she can provide for our students. And for individuals who may not be students at Purchase, like Catherine had referenced, there are larger resources for our friends or our peers who may not be Purchase student.
Mm-hmm.
Thank you. Any more questions? I will go then. So Zoya, we in leading up to this, we talked a lot about how there's a lot of stigma attached to STIs and that it can be a really big deterrent in getting tested for STIs. And so I'm wondering what your agency and different agencies are doing to help provide access. And you talked a little bit about this with Bernard's PrEP app, but what are agencies doing to make things more accessible and to reduce stigma in STI testing and preventing STI spread?
Oh, that's a good question. So I think that there is, fortunately, I believe we are moving toward a place where these conversations are being had more openly. And I do feel that that's where destigmatization begins, I believe it begins in the ability to have a conversation, and to also, it begins with the ability to understand our own personal biases and judgments and opinions. I think that many of us think we know those things very well, but it can come off in the slightest of ways. And clients or patients or really any human sitting across from you, you can bet your bottom dollar that they will sense that judgment and whatever, you know, whether it be lack of eye contact, whether it be checking the clock, could be such a small thing. One thing that we strive for, which is wonderful, is we keep really up to date with trainings regarding stigma, and as well as cultural competency trainings. And that actually I find an invaluable resource, and when they are facilitated by individuals with lived experience, I find those to be some of the most powerful messages for providers to hear. And I do, we do sort of confront stigma in that way, and keep up with our trainings. But I think it really does start with opening up a conversation and normalizing conversations about stigma. And we all, or some of us, or those of us who are sexually active, right? I think sometimes it's somehow easier to think about getting naked and jumping into bed with someone than it is to actually talk about sex before that happens. And I think that in the work that all of us do, it sounds like we're really trying to undo some of those fears. And when people are in fear, or when people judge themselves, or if people are in desperate situations, risks are going to increase. So I think that it's a really big question, and I wish I could kind of just fix it. But I do know that there are agencies like ours, and ones that we're aligned with, who really act to chip away at that stigma. Yeah, thanks, Lauren.
Yeah, thank you. Yeah, I think normalization, education, like you're talking about, those are the key things, and it sounds like you guys are doing some great work. So key to our sexual wellness and our students' sexual wellness is consent. And so we haven't touched that yet. And I'm wondering, Catherine, if you could talk a little bit about consent.
Oh, sure. So for New York State college students, everybody should really be looking at the enough is enough definition of affirmative consent. And it is different than what is in the criminal code, but on campus, it's really important for students to understand that each person has to be able to explain how they know that the other person is giving them consent. So anytime that we can, I know that unfortunately we don't learn how to talk about sex and consent with one another. But it is very important in terms of on a college campus today, so that each party understands what's happening. Also, it entails knowing the limits of that consent. So if we are saying yes to one action, it doesn't mean that we are saying yes to all actions or a progression of that action, right? So if we're saying yes to kissing, that doesn't mean that we're giving somebody else permission to then do oral sex, right? So each of those things would require explicit, consent for each party. Also, in a relationship or not, but the fact that we've had sexual activity or prior sexual history with a person never gives them the right to assume that we're okay with additional experiences without our consent.
Thank you. Such an important part.
Hop into that, actually. It just
Please.
thought, I think that's such a wonderful point, because I think that intermarital rape and assault was not recognized for a very long time. And I would argue that interpartner rape and assault is still, we're not quite there yet with how we think about and conceptualize those types of assaults that Catherine was speaking to. when it's a partner that maybe we have been sexually active with before. And I just wanted to thank her for bringing that up.
Thank you. All right, any more questions? We have a couple more minutes left if anyone has anything burning they want to ask about. All right.
That was a really useful presentation. I'm definitely going to visit the Hope Center and get tested in like 2 weeks or something.
Nice, awesome.
That's great.
Glad to hear that. Yeah,
A lot.
awesome.
That's amazing.
Thank you. That
Thank you.
made me tear up. It'd be great to also meet you in person too one day. Yeah. Yeah.
Yes, thanks,
Thank you.
Zoya.
Yeah, thank you, Zoya. Thank you, Catherine. Thank you, EJ. Thank you, everyone, for being here. I think this has been a really useful discussion, and I think we've started a lot of really good discussion about how sexual wellness looks on our campus and the resources that we have. We put a lot of information in the chat box. If you're not here engaging with this content right now, if you're watching this at a later time, feel free to send us an email at wellness@purchase.edu. We're happy to answer any questions. And again, thank you all. We hope that you join us next week for our Red Zone Prevention Friday standard drink demonstration. It'll be at 2:30 next Friday. You can hop over to our Instagram. Our Instagram handle is @wellness@PC, ATPC. You can check out all of our Red Zone Prevention Friday programming information there. All right, everyone have a great weekend. Thank you so much.
So thank you.
Thank you again, everyone. Bye.
Yeah.
Bye.
Thank you.